The pill. It was one of the most significant medical advances of the 20th century. But more than 60 years after the drug first hit the shelves, women are reassessing their options.
We're certainly seeing across the UK and Europe, in women under the age of 30, there is definitely a shift away from the hormonal methods. Part of that has been the influence of social media.
There's an overwhelming desire for a male to take partnership in the contraceptive choices.
I think really people have lost trust in a system that's not really designed for them and doesn't necessarily tailor to the needs of young women in this day and age.
Friends Susanna and Grace have a lot in common. The pair are in their early 20s, they studied at Edinburgh University, and unfortunately, both had a very stressful introduction to taking contraceptives.
I started to find that I was getting quite a lot of anxiety and that kind of thing. Maybe it's the pill because I'd heard that that could be a side effect from that. So I came off the pill and I discovered it was that was contributing to it. But I have never really felt like enough options were offered up to begin with.
So I started taking contraception, I think, around the age of 14, 15. And I started taking it for more of a secondary use. I was having very heavy periods, very, very painful periods. And that was the recommendation, obviously, of my GP was that could help to sort of alleviate those symptoms. It didn't really work, to be honest, but I continued to take it.
It took 9 years for doctors to figure out why Susanna was in so much pain. Eventually, she was diagnosed with endometriosis and was told the best way to handle her condition would be to have a non-hormonal coil inserted.
My pain levels are so much more manageable. It really has had a huge impact on my life, but I was very scared and very apprehensive about having that coil put in because it could make things worse, which is there is a lot of evidence to suggest it can at times do that for people with endometriosis.
There are more than 15 different methods of contraception available to women in the UK. Non-hormonal birth control, such as the copper coil and spermicide contraceptive gel, help prevent pregnancy without affecting hormones, while other popular methods, like the pill and patch, work to prevent the ovaries from releasing an egg each month. Susanna and Grace say there are still a lot of unknowns when it comes to figuring out which contraception is best. Both are a part of the Contraceptive Education and Reform Team, also known as CERT.
It's just undeniable that changes need to be made and improvements need to happen because it's vital. It's not because we don't think contraception is a good thing, it's because we think contraception is so important.
It can be a really, really helpful tool for so many issues. Obviously, mainly as a contraception, that is incredibly empowering to be able to take that choice into your own hands, but also for so many other conditions. But I think where the gap is finding the time to figure out which one is right for each circumstance and each individual.
CERT asked around 300 women about their experiences with contraception in Scotland. 79% said they'd had side effects, and strikingly, 95% think contraceptive care needs to be improved.
I think anything women's health related, to be honest, is very tiring for those who are involved in it. You can be treated like you don't really know what you're talking about, or your opinion isn't always valued.
Okay, I forget that people don't actually know what birth control does to you.
CERT is worried that women are now turning to social media for medical advice.
Your birth control is doing this, and I bet you had no idea.
You want some kind of experience stories, you want to talk to real people about it. So, people are going there looking up online and they're finding horror stories because, of course, dramatic things are always going to get the most interaction on social media. I've seen a lot of people discussing, using period tracking apps and that kind of thing, which, they do have their merits and stuff, but I think the user error is much higher.
And I've heard of a lot of people, saying, I'm taking a break from hormonal contraception, I want to reset my body. And whether that's actually something that exists medically, that resetting the body, resetting the hormones is quite contested, but it just feels that people are doing that as a last resort.
There is definitely some misinformation. One thing in particular that we are seeing is a lot of women being very worried about the effect of hormonal contraception on their fertility. And there is misinformation that using hormonal contraception can make you infertile permanently.
Which isn't true.
It's absolutely not true.
Dr. Malini Kanagalingam is a gynaecologist at a private clinic in Glasgow.
We have in recent years seen an increase in the number of terminations of pregnancy being carried out in Scotland. I think between 2021 and 2022 there was a 19% increase. And that increase was sharpest in the under 30 age group. So, younger women are maybe not being able to access the contraception that they need, or reliable contraception. And this may be leading to that rise. I mean, there are other factors as well, of course. There's things like access to contraceptive services, there's the cost of living crisis.
Malini says pressures facing the NHS have resulted in women having to wait a long time to see a specialist to discuss their contraceptive options.
Certainly post-COVID, access to services, there is less access, we know that. And also access to specialised sexual health services for women. We just don't have enough. I think we do need more choices for men as well. At the moment it's male condoms or a vasectomy if you're looking for a more permanent method.
For decades now, scientists have been trying to find ways for men to play a bigger role in the birth control space. Different types of hormonal gels are currently being trialled across the world, including in the UK, US and Australia. A contraceptive injection was also developed, but it failed clinical trials. But the University of Dundee could play a crucial role in increasing the options available.
I think the stumbling blocks there have been the fact that when you're trying to shut down the whole factory, it's quite difficult to do that. I mean, the example I would give is men produce 1,000 sperm in a heartbeat. So you've literally got to stop all of that production.
The team are working on a pill for men that will mimic infertility, essentially making the cells dysfunctional so they can't swim as normal.
The idea is to make those cells so that they don't work well or they don't work at all. And it's probably a lot easier to do that than to stop the whole production in the first place.
And that would be a reversible method, that wouldn't be permanent.
Yes, it would be reversible. And the advantage of that is, depending on which compound you got and how quickly it would have an effect, it could be very quickly reversible. So potentially that could be either days or even, 1 day.
The technology being used to test how certain chemicals react to sperm is unique to Dundee. Firstly, they're using human sperm donated by students, and secondly, they're using robots to test more than 1,000 compounds, a mixture of separate elements, every day. Previously, it took a month to screen just 30.
So what the robots are doing in the background there, they're working with plates like this. There's 384 wells, small little plastic wells. We put sperm in these wells. We can image the effects of those compounds on the sperm. And those effects we can measure, for example, the motility of the sperm, how they move, how they change shape, etc.
The team have already been able to find compounds that can kill sperm, but they need to carry out further tests before starting a clinical trial.
Clearly, we are proposing to give contraceptives to healthy people. So we have to come up with a drug that has a minimum and ideally no side effects. Think about that in relationship, for example, to cancer. And the side effects of chemotherapy can be quite significant. People get very, very sick. That obviously would be completely not acceptable in the case of what we're talking about here.
It could also be developed into a new non-hormonal option for women. But right now, the focus is on becoming the world's first male contraceptive pill. How close are we to seeing this being rolled out?
So I'm always optimistic about these things. So I think the idea of getting compounds that could be used at first to really use in humans for safety trials, I would hope that we would be in that position within about 5 years for sure.
But after decades of women taking the pill to avoid pregnancy, the big question is, would men be as inclined to go on it?
20, 30 years ago, there was a lot of data to say men were, even in partnerships, were slightly uncomfortable about taking compounds and their role in contraception. I mean, thankfully, those days are past now.
There would definitely be men who would want to take it. You know, it is important for men as well as for women to be able to plan pregnancies or, you know, be in control of their fertility.
If it doesn't work, the burden is going to be with the person who's potentially going to be pregnant. So I think there would be a fair amount of anxiety around it, but I do think that it is something that's been a very long time coming, and it is an option that needs to be there.
Currently, men and in couples, there's an overwhelming desire for a male to take partnership in the contraceptive choices.